The younger generation these days is falling prey to several terminal ailments and diseases early in life, be it cancer or heart ailments. The genetic traits, hormone imbalances, or just the erratic lifestyle can be held responsible for this. Adding to this list is a teenager who has been diagnosed with Alzheimer's disease. A Beijing-based expert team has reported the first ever case of a 19-year-old boy with Alzheimer's disease. This came as a shock, as this is a condition which is normally associated with elderly people. According to reports, the patient developed memory disorders at 17 years of age and has now been diagnosed with Alzheimer's disease, all at 19. The team from the Innovation Center for Neurological Disorders, Zhuangzhou Hospital, released the research results in a peer-reviewed medical journal called Journal of Alzheimer's Disease. It is revealed that the patient first began to have difficulty concentrating on learning, and 1 year later, the patient suffered significant short-term memory loss. The exact cause of Alzheimer's are still largely unknown, but a classical feature of the disease is the buildup of two proteins in the brains called beta amyloid and tau. One thing that you should know is that Alzheimer's is not a normal part of aging, and scientists are working to understand its causes. The main risk factor for the disease is getting old, which makes the latest case so unusual as the patient is still in his late teens. The team of doctors revealed that the patient has no family history of Alzheimer's disease and no other causes of memory impairment such as genetic issues, infections, or other diseases, which again raises questions about its risk factors. Nearly all cases of Alzheimer's disease in people younger than 30 are due to inherited faulty genes. In fact, the previous known youngest case, a 21-year-old, had a genetic cause. Other risk factors include Down syndrome, head injuries, and cardiovascular dynamics. Cases of early onset Alzheimer's disease are on the rise in younger patients, and sadly, there's currently no cure for it. We would also like to add that there's no certain way to prevent the condition, but a healthy lifestyle can help reduce your risk. So let us tell you the small yet important things you can do to reduce the risk of this condition. You should control vascular risk factors including high blood pressure, high cholesterol, and diabetes, as these are some of the known risk factors. Smoking increases the risk of vascular problems including strokes or smaller bleeds in the brain, which are also risk factors for dementia. Apart from that, toxins in cigarette smoke cause inflammation and stress to cells, which have both been linked to the development of Alzheimer's disease. Your alcohol intake should also be limited. You should eat a balanced diet which is rich in vegetables, fruits, lean protein, and omega-3 fatty acids. It is also important to keep your brain engaged and try learning new things every day. Instead of browsing your phone in your free time, you should practice your hobbies. Lastly, one should be physically active, as regular exercise can significantly reduce the risk of developing dementia. We hope this video helped you to understand Alzheimer's disease and how to prevent it a little better. Stay tuned for more and do subscribe to Showsha for more such health content.